Hello dear viewers, I am Dr Aashaq Hussain Bhat, Consultant Urologist based in Srinagar, J&K. Today I am going to talk about the management and the problems faced in the management of BPH, that is benign prostatic hyperplasia, in this global pandemic crisis of COVID-19. The benign prostatic hyperplasia is a benign disorder. It's not a malignant disease. It's a benign disease in which there is benign enlargement of the prostate causing irritative and obstructive lower urinary tract symptoms. Irritative lower urinary tract symptoms include frequency, urgency, nocturia, while in obstructive lower urinary tract symptoms there is hesitancy, there is poor stream, there is intermittency, there is straining. So far as this global pandemic crisis of COVID-19 are concerned, it has taken a toll in the management and the surgical management of all the benign diseases, including benign prostatic hyperplasia. So the patients of benign prostatic hyperplasia can be divided into three subcategories so far as this pandemic is concerned. Those patients who present for the first time with symptoms of lower urinary tract symptoms. Number two category will be those patients who are already known case of BPH and are being managed on the medical management. And number three category patients are those patients who have developed some complications due to BPH, like gross hematuria, recurrent urinary tract infections, like obstructive uropathy causing back pressure changes, or any other abnormality. Now, so far as the first group is concerned, those who present for the first time with lower urinary tract symptoms, it's advisable for such patients in this global pandemic to contact their doctor, local doctor, if possible a urologist. They can contact him via voice calling. It can be some messaging like SMS or WhatsApp, or a video calling, and explain their problems. Their symptoms can be tackled by telemedicine consultation only. Rarely there will be any requirement of any visit to a healthcare professional or nearest healthcare facility. If the doctor feels so, he may advise you accordingly. Number two category of patients, those patients who are already known case of benign prostatic hyperplasia, it is advisable for them to continue the same medicine as has been previously advised, not to discontinue their medicine, continue the same medication. If at all they develop any on and off some problems, they can contact their doctor via phone, SMS, WhatsApp, voice calling, video calling, whatever is the source of communication. But for such category of patients, it's strongly recommended to continue the same treatment till they can meet their urologist in the near future, whenever the condition improves, whenever the global crisis, the condition of the global crisis improve. Now, the number three category of patients, those patients of benign prostatic hyperplasia who have developed complications in the form of gross hematuria, complications in the form of lower urinary tract symptoms with urinary tract infections, recurrent UTIs, back pressure changes causing obstructive uropathy, or causing bilateral hydroureteronephrosis, causing renal insufficiency, or there may be other issues like associated stone disease in the bladder causing retention. For such patients, the optimization is the rule in current crisis. What we mean by optimization? For example, a patient of benign prostatic hyperplasia who has been diagnosed with having bilateral hydroureteronephrosis causing renal insufficiency or causing acute azotemia. In such patients, in current situation, it is recommended to go for a catheterization. For that, they may need to visit their local healthcare facility, taking all the precautions, put in a perurethral catheter till the back pressure changes are subsidized, till their azotemia returns back to normal, is optimized, and later on, once the situation improves, the definitive management or the surgical management can be taken up. Same way, a patient of benign prostatic hyperplasia who has developed recurrent urinary tract infections, it's advisable to go for a urine culture if possible, or a broad spectrum antibiotic to treat the urinary tract infection in the present crisis. And later, once the situation improves, we can evaluate the patient and look for a possible surgical management. So in such complicated patients, the rule is optimization. For this optimization process, the patient might need a visit to a nearest healthcare facility for the first aid or the emergency based treatment, and the permanent treatment or the definitive treatment can be taken later on once the situation improves. So in nutshell, we will say the surgical management of BPH in current crisis should be deferred in whatever possible circumstances, and once the situation improves, this elective surgical procedures can be taken up later. And if at all during this process the patient develops any complications, for that they may need to go to the nearest healthcare facility for first aid management or immediate treatment and for optimization. That is the crux of management of BPH. Better to avoid surgeries, stay home, stay safe, maintain distance, wash your hands frequently, maintain good healthy social distancing, take all the necessary precautions. Thank you very much.